And on health, the Nigerian government and the World Health Organization, WHO, have reaffirmed their commitment to tackling severe non-communicable diseases, NCDs, through the expanded implementation of package of essential non-communicable disease interventions, PEN Plus strategy across Africa. They declared this during the opening session of the second international conference on PEN Plus in Africa, held in Abuja. Our correspondent has more on this report.
As the burden of severe non-communicable diseases rises steadily across Africa, Nigeria is scaling up its intervention through the PEN Plus strategy, a World Health Organization endorsed framework aimed at decentralizing care for chronic conditions. This approach, now adopted by over 20 African countries, focuses on delivering essential services for life-threatening NCDs at the district and primary healthcare levels. Speaking at the opening session in Abuja, the Minister of State for Health and Social Welfare, Dr. Isiaq Salaku, reiterated the government's resolve to integrate PEN Plus into the country's primary healthcare system.
The scenario in our region today is that the burden of NCDs is higher than the global average, with most sufferers unaware until irreversible and fatal complications has occurred. Most worrisome is the fact that younger age groups in the most productive stages of life are being impacted, with newborns and children not spared. Africa must therefore rise up to tackle the burden of NCDs in the continent, not just as a health issue, but as a matter of human security, economic progress, and sustainable development.
The minister also outlined plans for a public health tax on healthy products such as sugary beverages, alcohol, and tobacco as part of a broader effort to fund health promotion campaigns.
The approach is first to focus a lot of attention on prevention, using modification of habits, lifestyle changes, awareness creation, and in some instances, chemo prevention and vaccination. So we're combining this strategy of primary prevention, secondary prevention, and tertiary prevention in terms of early diagnosis, comprehensive care, to ensure that we're able to address challenges around NCDs.
According to the World Health Organization, Africa faces a growing epidemic of NCDs, with nearly half of the premature deaths from these diseases occurring in people under 70 years. The WHO African Regional Coordinator, Professor Mohammed Yakub Janabi, called for urgent and unified action to combat the growing NCD crisis on the continent.
Millions across our region continue to face severe NCDs without access to essential care. We need to scale PEN Plus to all 47 member states by investing in local health workers and ensuring that care is accessible to those who need it most.
Non-communicable diseases has become an epidemic in Africa, and it is time Africans confront it or be consumed by it. So we bring this conference to Africa, to Nigeria, especially Nigeria, because Nigeria has the highest number of cases given its population. It is time to deal with the problem of sickle cell diseases. It is time to deal with the problem of diabetes type 1 in Africa. It is time to deal with rheumatic heart diseases and other heart diseases.
Others emphasize the importance of tax shifting and workforce training.
So what we do as a network is we work closely with the World Health Organization, with UNICEF, with national governments, and we coordinate implementing partners now across 29 countries to support the implementation of PEN Plus, and also to look at priorities in the health sector for non-communicable diseases, making sure that those that are living in poverty and those with the most severe diseases, children and young adults, are reached first.
The conference themed Advancing Implementation of PEN Plus for Severe NCDs in Africa, Technical Innovations, Operational Insights, and Scalable Solutions brought together health leaders, development partners, and practitioners to explore best practices in delivering care for chronic diseases such as type 1 diabetes, sickle cell disease, and other heart disease.